Well, since the pandemic locked the country down back in March, many of us have experienced weeks or months of anxiety, fear, sadness, and social isolation. October is Depression Awareness Month, and Susan Harrington is a licensed marriage and family therapist at Maison Vie. She joins us right now, and we're talking about the signs and symptoms of depression. Obviously, depression is a very large spectrum. If you can kind of explain to people, I know there's a lot of myths and confusion for a lot of people about what is and what is not depression. So if you can kind of clarify that for us, we'd love that.
Certainly, certainly. And it's a really important topic to talk about because what we know before the pandemic is 1 in 4 people are diagnosed with some type of depression. That's 25% of us, which is huge. And what I've also learned working in this field is when people get into services within the first 6 or 7 months of feeling it, they have a better chance of recovery within a year. So it's really important that we talk about this. The signs that we want, go ahead.
I'm sorry, go ahead. No, go ahead.
The signs that we're looking for that are most common are things like change in our eating habits and sleeping habits, change in our irritability, feeling very negative or withdrawn, sad, melancholy, those sorts of things. Feeling hopeless is a really big piece to look for. However, we also want to consider some other things that we don't typically look at, like eating problems with our digestive system that we can't explain, or physical pain. Those sorts of things are also common when we have depression. Then children and teenagers show up differently. They will show up more anxious and irritable. And so it's really important we look at it from different perspectives.
And obviously we have a lot of things happening right now, a lot of outside things we can't control. We just talked about this hurricane that might be coming our way, this pandemic that none of us can control. A lot's happening politically speaking. Are any of those factors weighing in on you guys, on people, and are you guys seeing more cases of depression? And would you consider that more situational depression, or how would you even categorize that?
So that's quite a bit, Kelsey. So what we know is that since the pandemic, depression and interpersonal struggles have increased by 40 to 50%, which is huge. And so the mental health field is noticing a great influx of people coming in, which is great because we need to have that support. So it is really important for people to go talk with their primary care physician and say, hey, so I'm having this feeling. Then the physician can help them determine if it's physical or if it's situational or if it's cognitive, like there really is a depression disorder in place. And how to get services. It's really a valuable piece. We are noticing those changes. And so we can provide treatment for people in those situations and very successfully.
And you mentioned therapy, you mentioned treatment. We only have about 30 seconds. If you can kind of briefly explain what options people have out there if they are experiencing any of these feelings or if they have been diagnosed with depression.
Absolutely. So we have 3 that are research-based that we know of. So cognitive processing therapy and cognitive behavioral therapy are really good for folks who've had trauma. We have folks that are looking at seeing more problem-solving kind of things. When they have a situation like we're having now, they can go in and do something that's more problem-solving focused, like solution-focused therapy. And then for folks who are finding difficulty addressing these concerns interpersonally, Maison Vie at my office, we're really great at doing interpersonal therapies and addressing family distress that's happening around the pandemic, like going back to school and working at the same time, and kids at home and school.
Well, Susan, we really appreciate your time. And again, people just need to pay attention to how they're feeling right now, especially with so much happening, and seek help from your doctor if you so need it. We appreciate your time this morning, Susan.
Thank you, Kelsey.
All right, now let's check in with Shelby Latino, who has an update